Hey guys, welcome back to Living with Long COVID. Jade, me. And this week we are talking about something that's been talked about a lot recently, nicotine therapy. After 2 years and 3 months of living with long COVID, I decided to try something that I'd heard about quite a few years ago, the nicotine patch therapy. It's been circulating in long COVID forums and in communities. And in this video, I'm going to give you my day-to-day account of what the 7-day nicotine trial did and what happened to me. I first heard about nicotine therapy way back in like 2024, probably end of 24 when I'd been diagnosed with long COVID for about 8 months. I saw it in the forums and of course I was hesitant to try it. Nicotine is highly addictive and comparable to cocaine and heroin, according to the FDA and other medical websites. And it creates dependence that makes quitting really difficult. With all the other medication that I've had to take, nicotine just didn't feel like something I wanted to introduce into my body. However, after a particularly rough month and a bit, with a combination of jet lag at the beginning, then a flu, and then just bad symptoms lasting for no reason that I can understand, and then on top of that being like, this is year 3 of long COVID for me, I had very few options on the table, so I thought, why not? But I want to be upfront about this research though. It is shaky at best. I have done as much research as I possibly could. I found probably the best 2 studies, but neither of them are peer-reviewed. One involved fewer than 10 patients, and those patients only had their symptoms for less than 3 months, which doesn't actually meet the technical definition of long COVID. You're supposed to have it for 3 months or more. So evidence base is thin. That said, both studies showed these incredible results with fatigue being relieved in 7 days and, all these people going on to live normal lives and being completely recovered. Is that actually true? Let's find out. Since the protocol is only 7 days, I figured I had little to lose, apart from maybe getting addicted to smoking, but we'll find that one out later. So the idea is that you microdose nicotine patches for 7 days. And at the end of this, I may be a smoker, but hopefully without long COVID. So let's go. So day 1 was pretty horrid. I had nausea, I had aches, head pain. I felt absolutely terrible. And then I realized I'd made a massive mistake. I was accidentally using double the recommended dose of nicotine. So once I cut the patch down to the correct size, I did feel significantly better. However, the nausea did stay with me.
Hey guys, it's end of day 2 of the nicotine trial that I'm doing, and I just thought I'd check in to let you know that, well, I realized today that I was on double the dosage I should have been, and once I cut the patch down properly to the proper dosage, I felt way better. The nicotine is making me feel really nauseous, and once you cut the patch down then you only feel a little bit nauseous, but I definitely had a lot more energy today. Like it got to sort of 3 p.m. and I wasn't that fatigued, so I felt pretty good. I was able to focus and spend like up to 2 hours on the laptop without even realizing. So yeah, that's really good progress, and I just need to make sure I take the right dosage tomorrow.
Let's see how day 3 went.
Hey guys, so yesterday was day 3 of the nicotine patch test for long COVID, and what was it like? Well, it was fine. Unfortunately, I was still really fatigued in the morning. I did have quite a few medical video calls, and then the afternoon I was able to focus for 2 hours straight without even realizing, so my head was really clear. Although I'm not sure that's due to the nicotine, but yeah, I had the energy to kind of keep going on my task, so that was pretty cool. I wasn't like jumping up and down energy, physical. It was more sort of like a mental energy. So this is going well. Fingers crossed.
Day 3 followed a similar pattern. Mornings were the same, doing work, getting a bit fatigued, but the afternoon mental clarity was quite huge. Normally, I write off the afternoons as I cannot just do things, I can't concentrate, things are worse. But finding this mental clarity was really exciting. My head felt clear, I could keep going on with tasks without the usual fog dragging me down.
Hi guys, it is day 5 of the nicotine patch trial for long COVID, and the last 2 days, because I skipped day 4, I've been feeling really fatigued in the morning, so still really clear-headed and really able to do things, brain work. However, I don't seem to have much energy and tend to crash a lot earlier, around about 12. But then I wake up and I'm feeling quite clear-headed in the evening, although today on day 5, I felt quite drained. So yeah, I'm not sure that the nicotine is helping with my fatigue. It feels quite a lot of fatigue today. So maybe I just overdid it this morning. I don't know. We'll see. I feel like I might as well just keep going. We've only got 2 more days. So I'll let you know how it goes.
So as I said in this video, day 4 and 5, fatigue was still there and I was crashing earlier around midday, which is quite a few hours earlier. So that's not an improvement. But the afternoon clarity persisted despite the fatigue still being there. 2 days to go.
Hey guys, so this is the day 6 nicotine patch update. So yesterday I went out, I felt okay, and by lunchtime I was just really wiped. So that's kind of normal for me. That's not different, which is a bit sad. However, I did wake up after my nap in the afternoon and I felt relatively okay. My limbs felt a bit heavy, but I was able to go out for dinner. So not a huge change for me. I don't feel that there was anything particularly energizing about the nicotine so far. Maybe just in the afternoons it's given me a little bit of a boost, so after I wake up from my nap I feel a bit better. But we'll see. So tomorrow is our last day. I will see you then. Bye.
So that was pretty typical for me. Being wiped out by lunchtime is no different from my usual long COVID days, which is a bit disappointing, to be honest.
Hey guys, so this is your day 7, final day of the nicotine patch update. So it was yesterday. I wanted to wait the whole day to see if there was any change, but honestly, I woke up pretty exhausted. I did have a late night. And then after 2 hours, I just crashed, massively crashed. I was just pottering around the house, doing washing and stuff. And then major crash, had a nap early, and then woke up and just felt so heavy. Like the whole day I just felt really heavy, and all afternoon, evening, it just wasn't great. So I have to say that unfortunately this nicotine patch therapy 7-day thing has not worked for me. It was a bit of a long shot to begin with, but I'm glad I tried it just to see. But there you go. That was my trial of the nicotine patch therapy for 7 days as per the studies.
The final day was rough. As I said, I had a late night, woke up exhausted and crashed. The whole afternoon and evening, I felt so heavy and horrible and I couldn't shake it. So there you go. I found a tiny bit of energy in the afternoons, mental clarity that is, which I will say has weirdly persisted since even stopping the nicotine. Since then, I'm able to maybe do a few things in the afternoons rather than just writing them off. So was that the nicotine, or was it just my body very, very slowly healing over time? To me, this is always the biggest question, because having now been 2 years and 4 months, I've definitely seen improvement in my fatigue and my pain. You don't have to believe me. I've actually kept a tracker so you can actually see. I've charted it. So here is my fatigue chart from February 2024 all the way to now, 2026. So clearly my body is slowly recovering as the average score has gone down from 5.5 to 4 out of 10 on fatigue scale. And my pain has been much, much better, of course, due to all the pain medication and treatments, going from an average daily pain of 4, which seems low to me at the time, but anyway, to 1.3 now. Unfortunately, the 7-day nicotine patch therapy, it didn't really work for me. I want to be clear, I went in knowing it was a long shot. I'm genuinely glad I tried it because I found a little bit of energy boost in the afternoons. But the results that they promised in the studies, the incredible overcoming of fatigue, the lessening of pain, none of that was there for me. The one thing I consistently noticed was a small energy boost in the afternoons after waking from a nap. It is worth noting the main side effect of the trial was nausea, which was much more manageable at the right dose, but just not great to have consistently for 7 days. And I imagine it may go down the longer you use it, but I just don't really want it. So honestly, I don't think introducing nicotine into your body for a mild afternoon lift with nausea is a good trade-off. Personally, LDN does way more for me than the nicotine. With LDN, I did notice quite a significant energy boost, as well as less muscle aches and less pain. So that would be my recommendation to try. It actually has numerous studies around it that are proper long COVID patients and a good selection of patients. And it has been acknowledged by medical professionals that it can help. And it is something that you can access and it is safe to try and it's available. Whereas nicotine trial is not something any doctor would ever suggest you try. If you want to know more about LDN, here is my video somewhere above me, and I also interviewed Linda, who's the head of the LDN Trust, so you can hear more about it from her. The nicotine studies themselves were from a tiny pool of patients who weren't properly screened for long COVID, and all of that says to me is that they weren't really well done. I think the reason these studies haven't been taken further is probably because in practice, the results simply aren't compelling enough for the medical community. If you're curious about the studies I've referenced, I will link them below in the description so you can read them for yourself. Obviously, different things work for different people, and I am not a doctor nor a medical professional, and these are just my experiences. Whatever you do, I advise to be safe as possible and think about what you're doing and also research it. So what now? Well, now I just keep going and on to the next thing to try, which I think is going to be HRT, but I'll let you know. I'd love to hear your experiences and if you have any suggestions for future videos or therapies. If you do like this video, please give me a thumbs up, please subscribe. It means a huge amount to me because it's just such a small channel at the moment and I would really love it to grow to be able to help more people. If you like this video, and I'm really glad, please let me know. Forward it to a friend who it might help. I would be so, so grateful because it takes a huge amount of energy to make these videos and sometimes I do wonder like, is it worth it? But I really love helping people and I hope this has helped you in some way, shape or form. So till next time, stay positive, stay safe, and I will see you very soon. Bye.